With precision and state-of-the-art technology, Austin CyberKnife treats the most delicate of tumors. Dr. Matthew McCurdy is a radiation oncologist. He's here specifically to talk about brain tumors, how they treat those, and it is Brain Cancer Awareness Month, Doctor. So I know there are many, many kinds of tumors we could talk about, but really we want to get to that this is such a great alternative to surgery in many cases, right? Or can be.
It can be. You know, there are many different types of brain cancer. Typically, we find when we're treating brain cancer in the brain, it's cancer that's spread to the brain. So it's not, it hasn't come from the brain itself. And sometimes that's treated with surgery. More often now, we can treat the cancer that's in the brain, all of it, with focused radiation. And CyberKnife is considered probably the best way to give this kind of focused radiation throughout the brain.
So when someone comes in for that treatment, what's that process like? You're actually in a totally different room from the patient operating the device,
First,
right?
of course, we meet the patient, talk all about it, say, is this something we move forward, and we do special imaging. And then for the actual treatment, they're in a wide open room listening to whatever music they want, and just, you know, not feeling a thing during the treatment. There really are it's remarkable, there are relatively few side effects, if anything.
What are some of the advantages, that being one of them, few side effects?
Few side effects. It's non-invasive. It can be cheaper, it can be repeated, and it's certainly not, CyberKnife is not something that's used in all cases, it's not appropriate in all cases, but it certainly is, it's a very exciting area that we can treat, you know, patients that previously they would have to have part of a nerve removed, or otherwise the cancer might come back. And to do it with this technique, it's very rewarding.
I know it varies from case to case and patient to patient, but would it mean a lot fewer treatments? There's more concentration in fewer treatments?
It does. The old way, they would have to come in every day for, say, 5 or 6 weeks. And this is often just one treatment.
Wow. What has been the response of some of the patients you've treated in this particular scenario?
It's wonderful for them, and what they don't know is we see how we used to do it, and how when treating the whole brain, or much more of the brain, people would have cognitive impairment or other side effects, memory loss, months out, whereas now we don't have that when we instead treat just the spots where the cancer is.
And I know you're all about helping people get better, but you also love to provide people with a continued quality of life as they can have it and go about really their daily business, right?
It's more and more important now. We have these new targeted agents that the chemotherapy doctors give, so patients are living longer and longer, which is great, which means we need to make sure their brains are functioning years out now.
Yeah, fantastic. Thank you so much. We appreciate your time.
You're welcome.
Austin CyberKnife is located on I-35 near the Dell Seton Medical Center at the University of Texas. Call them at 512-324-8060 or go to austincyberknife.com.